Hey everybody, it's Dr. Tassone here. Hey, I just wanted to get on real quick and talk about why I do Essure removals. I think it's getting a little bit confusing now that there are more and more physicians that are doing the removals. And I think some of the people that post comments and whatnot are worried about the fact that I might say something that they don't agree with, which is great. I mean, wonderful thing about this country. What do I say and what do I mean, I guess? Because during posts and stuff, written stuff, you can't really tell the tone of a message. So I just I wanted to tell you guys what I'm meaning to say and actually have the words to hear kind of what I'm talking about. First of all, anybody can do an Essure removal. Okay, I believe that wholeheartedly. I don't obviously think I'm the only person in the world that's doing them. And if it's done via hysterectomy, then any OBGYN can do that and should be more than happy to help you with that. Now, I have had a couple of patients that have had straight vaginal hysterectomies or have had laparoscopic hysterectomies where the tubes were cut through and then taken out later. I don't necessarily agree with that approach. I personally think the approach should be to leave the tubes attached to the uterus, but again, that's my opinion against somebody else's, and I'm not ever saying that my opinion is more important. What I'm saying is I'm just basing this off of my 4 years of removals and about the 350 or so cases that I've done up to this point. The second thing would be, I think what people get confused about is removal versus reversal. And reversal obviously needs to be done by a specialist that not only knows how to do a reversal, but knows how to do a reversal with the Essure device. And obviously we're talking about somebody like Dr. Monteith or Dr. Sills, if he's willing to do those, maybe Dr. Derone in Atlanta and California, as well as North Carolina. So that's a removal. Removal is where you take the coil out, and then you also not just take the coil out, but you put the tube back together. So you excise a piece of the tube, and you take it out, and then you put the tubal stump back together. So what I'm talking about when I talk about removals is when you actually remove the tube and the coil, and you remove it what I consider the right way, but obviously that's up for interpretation apparently. So what I mean by a removal is I think that you should remove the coil in one piece still inside of the tube. Obviously, again, my opinion, I think that it's, based on the sheer numbers that I've done, trying to pull on those coils or, obviously cut through them will increase the risk of fragmentation. And obviously, we know once they fragment, they're going to be really hard to get out at that point, even if you can see them on x-ray, because you're dealing with really small pieces. So when I ask people, what type of surgery did you have done? And I'm trying to find out how they remove the tubes from the uterus, because I want to know what's being done. As more and more doctors attempt to do this removal procedure, they're going to just do what they think is right. And that's great. I mean, we all have to start somewhere. And I'm not condemning anybody for that. And in most cases, you probably will have a good removal and things will go fine. But if it's pulled on, there's always the chance of fragmentation or leaving behind those PET fibers. And so looking at operative notes, looking at pathology reports, it's easier to tell what type of procedure is being done. And I think it's just more for educational purposes for my colleagues to consider possibly doing it a different way. Now, the way that I do it, it's a little more involved. It takes a little bit more time. And unfortunately, there isn't a different CPT code for it. So it's a very minimally reimbursed procedure, which, is unfortunate because it does take a while, but I think it's the right thing to do. And I think gives better results. So when I ask about people doing removals, it's not because I'm trying to say that I'm better than anybody else. I don't think that. I never would say that to my colleagues. I mean, it's just not something, it's not the way that I practice medicine. But what I'm saying is there are varying degrees of experience. Somebody has to be somebody's first case, right? I mean, I had a first case. But the question is whether or not they're doing that first case the right way. And the right way isn't always determined by one person doing this or one person doing that. It's just opinion. It's just my opinion. Obviously, you know, the great thing about this country is we can all have opinions. And my particular opinion with removing tubes and coils is just that they should be taken out in one piece, coring into the uterus to get the track out, the part of the coil or fallopian tube that is in the uterus, because I have seen many pieces left behind inside the uterus that now need hysterectomies because it wasn't removed the right way. That includes more costs to the patient, more costs to the insurance companies. It's more pain and suffering because you have to have an additional surgery. So I just want to find the right way to do it. I want to find a good way to do it, and I want to find the best way to do it, and the safest way to do it, and the most cost-effective way to do it for everybody involved. So if anybody has any questions about that, I'd be more than happy to answer them now. I just really wanted to get on and just kind of get rid of some of the, sentiment that, maybe I'm feeling a little bit more superior than other doctors, and I don't. I promise, I really don't. Like I said, I had to start somewhere. But I do think that there's some doctors that are better with certain procedures. There's certain doctors that are obviously better with robotic surgery, some that are better with laparoscopic surgery. There's doctors that specialize in, myomectomies and removal of fibroids. Everybody has a niche. And some don't. Some prefer to just kind of do generalized things. And I have just kind of filtered into this specialty of doing Essure removals. And it wasn't because I was actually looking for it. I wasn't trying to find something. It just sort of happened. I did one a couple years ago. Then I did 2 the next month, and then 2 the next month, and then 3 the next month. And then kind of it started ballooning until I was just doing a bunch, and probably doing 20 or so now a month. What that does is it does give you kind of a breadth of experience and a breadth of knowledge, and something that I'm very passionate about now. And I do feel like I'm an advocate. I do feel like I want to do what's best by the patient, and I want the patient to have the best possible outcomes. And I think that just based on sheer volume, there's other folks out there like, Einarsson in, I think he's in Switzerland. There's a doctor at Vanderbilt that's done some removals, probably close to 100 by now. There's Dr. Aurora in Ohio that's doing procedures, and has done a bunch from what I understand. There's, like I talked about, Sills and Monteith and Navoa up in El Paso. I don't know everybody's numbers, but I would never dissuade a patient from going there. But I also know of people that have had some bad outcomes, and while I would never mention names, all I do is ask a question. How did they remove it from the uterus? How did they get the tubes and coils out of the uterus? And I always say, and I would say this now, they should always draw you a picture if you don't understand how it's going to happen. And they should always be able to explain it to you. I think one of the things that's happening as I come across on Facebook sometimes is like I'm being critical to somebody that just had their surgery done and they're recovering, and I suppose that can seem maybe a little bit insensitive. And I really don't mean it to be that way. And I'm sorry. I'm totally sorry if that's the way that it comes across, because I really am not trying to really get you at a down moment. It's just when I see it, because it's online and I see you just had the surgery, and so I'm, mentally trying to collect data. And, I've decided that that's probably not the best way to do things, so I'm not going to ask anymore. If anybody ever wants to, and I have women send me their op notes sometimes, I won't put my opinion out there unless it's asked. And and that's great feedback. I appreciate the feedback. I want to know what's going on. I want to know how you feel. I want to know what you think. And it's great to have some feedback, and it isn't always going to be positive, and I get that. So if anybody has any questions live right now, that would be great. If you don't, I'd be more than happy to answer comments once you see this, if you see this. And just know that I really do feel like we're in this together. I've been to the FDA. I've learned a ton in the last 4 years. Um, and I freely admitted from the beginning that I've put in a bunch of Essures. And I don't think that every woman that has Essure in has problems. I think there's a significant number, maybe 20 to 25%, that might have problems. And those problems are serious and they're oftentimes ignored. I think it's getting better. I think that it's getting recognized more. And I think Sills, by editing and publishing this book with Nova, with some of the chapters that were written by a bunch of people that are actually removing these coils, is going to help immensely. Put some data out there in the field that maybe other doctors can look at. I want more doctors to do this procedure, and I want more doctors to do this the right way. There's 750,000 of these kits that were sold in this country alone, and I can only do so many. So I really think that we need to have 10, 20 doctors in every state that are doing these and doing these the right way if there's a demand there. And I think eventually there will be. So does anybody out there have any questions or any concerns or comments that they want to bring up before I finish this quick note? So July, on a different note, is National Fibroid Month, Fibroid Awareness Month. And I'm going to be doing a post on fibroids and a new procedure that's out called Accessa that actually doesn't involve a big incision in your belly. We can shrink the fibroids internally. Oh, there are questions. I can't see the comments. Hang on just a second. Thanks, Jenny. I don't know why I can't see the comments. Okay, Becky. What about for people whose coil has broke and not sure the placement of the piece that's left? Well, we can get an idea of where the coil is based on an x-ray, and we can see how big it is, see how difficult it's going to be, and we can actually find out a lot of information before the case. And then while you're in the case, what I've done in the past with these fragments or pieces is we can take an x-ray in the operative room, and I put markers on your belly, like a pen or something, radio opaque, that will show up, and I can tell kind of where the piece is based on the picture that I take. And usually my assistant Tina has a really good set of eyes, and basically we look around in those spots until we find the coil, and then a couple times we have to take more than one x-ray, but usually we can find it and we can get it out. Thanks, Kim. The number to the office is 512-956-0296. Thank you for putting that in there, Jenny. How much would it cost for tube removal, since mine are in my tube still? I think my hospital here in town, St. David's North, has a pretty good pricing system. I don't know the exact prices, but if sorry, somebody just called my phone. I'll get Jenny to put something, I'll give her the information on Monday or Tuesday, and it can be available to whoever wants to know. Jerry Bailey, endometrial bleeding cyst. So endometriomas are endometriosis on the ovary that will respond to cycles, and those can get bigger and bigger and bigger. I just did one yesterday, that was about 8 centimeters, and they can be extremely painful. Bleeding cysts or hemorrhagic corpus luteums can actually be something different in the sense that hemorrhagic cysts happen during ovulation, and they just bleed, and they bleed, and they bleed, and they bleed. And most of the time those women wind up in the emergency room for the pain. And they'll do an ultrasound, they'll do a CAT scan, and they'll find that there's kind of nothing going on there. So what happens is they usually just rest, pelvic rest, and wait and give pain medications. And usually the pain resolves in about 7 to 10 days. Susan, you're very nice. I really appreciate that. Susan came in yesterday from Idaho. If coils are in place as a total hysterectomy has been done, is there still need for concern of fragments if you feel ill? It's hard to say, right? I mean, we don't really have a lot of data on that. I think the best thing to do if you're worried about it, and a rather inexpensive thing to do, would be to just ask your provider for an x-ray of your abdomen and pelvis. It's fairly simple. It takes about 5 minutes, and would be able to tell them if there's a fragment at all inside your pelvis. And that would be, you could get the answer that day. How many removals have I done today? I'm thinking it's close to 350. Maybe somewhere between 350 and 400 now. I have a fragment from Essure. It went out July 28th, but the place... Monique, I'm having a hard time understanding. Maybe if you retyped your question, I could answer. Yeah, Yvonne, I know my Google number is wrong, and I've asked them 3 times to change it, so they have to mail a postcard to my office or they won't physically change it. And they keep saying they've sent me the postcard and I haven't gotten it yet. So I'm obviously working on that, but I appreciate you bringing that up. Nathan, thank you. Shannon, what's the biggest concern of having PET fibers released if the coil is pulled out? One of mine was when it was pulled out, my uterus where it had burrowed into. I would like to know. Well, there's a couple of things, and I think you're bringing up 2 points. One is if you pull the coil out, there's a chance that if it was embedded somewhere, it could lacerate, cut, bleed. That's why it's not recommended to be pulled out, at least vaginally by the manufacturer. But the other thing that we don't know about, if you think of PET fibers, those fibers are similar. They're basically like a polyester material, a plastic resin or a polyester resin that's coated around the insert of that device. Now, theoretically, it probably stays on that device, but if you're pulling it through and it's rubbing along those tissues and it's microfibers, it would make sense that maybe some of those can splay off and stay inside of the uterus or the tube that's left behind. I don't know what that would do. I just know that if I'm in there doing surgery, I don't want to leave those behind because I don't know what they do. We know that PET is a neuroendocrine. We know that, sorry, somebody called me again. We know that it's probably not the best thing to have in your system, but there are a lot of implants out there in orthopedics and other professions that do have that. So it's debatable. I just know that when women come to me and they want them out, they want everything out. They don't want pieces left behind. So I just try to do whatever I can to do that. Yvonne, you should be my office manager. I had somebody tell me today that I bungled my my office transition, and I don't feel like I bungled it. It was definitely difficult, and I have to give Kim some huge props for Kim Harlow, my MA. She did it single-handedly with Jenny helping answer the phones. I brought Jenny on and surgery scheduling as well. But it was difficult from the beginning, and I'm very sorry for that. We are definitely getting much improved at this point, and again, I'm very sorry for the transition, but it's every day it's a lot better. So Monique says, I have the rest of Essure in my body. Comes out in 2 weeks, but I'm so tired. Your weight is not coming. I can eat what I want. Actually, what I've seen, and this is just in my cases, I've seen a lot of women gain weight with the coils. Again, I don't know if it's just correlated. We certainly can't produce causation with that. But let's hope that when you do have the surgery in a couple weeks that it helps you. It's possible that maybe your thyroid is dysfunctioning, or maybe you're hyperthyroid. You should have those checked. I do hormones on everybody before I check those, before I do the surgery, just to make sure. Any thoughts on UFE with Essure in place? What's UFE, so I understand what you're talking about? Shannon, that's probably a good idea. Just make sure that what I would tell any physician is, if you have kind of a second case that's coming up, like if you're a patient that's had now, this is going to be your second surgery, to X-ray the coil or X-ray the uterus in the operating room. So I'll have the big C-arm X-ray come in, and I'll put the uterus on the X-ray machine, and I'll X-ray it to make sure that I got it out. The nice thing about that is I don't have to expose you to the X-rays. I can X-ray the specimen. I just did it a couple weeks ago and posted online because I couldn't see the coils. I couldn't feel the coils in the tubes, but I knew they were in there from the preoperative X-ray. So I X-rayed the uterus, and the coils were just embedded deep inside the uterine muscle. So I would definitely recommend that you have something done X-ray wise before they leave the operating room so they know that they got it. Anything else? Thanks for all the questions. It's been helpful. Again, I'm gonna back down a little bit on my Facebook posts. I have my own Facebook website, my own Facebook page. That's this one right here. But I have one for Essure Method Removal. If you want to look at that, it's just search Facebook for Tassone Method. It'll come up. You can join that site. I'll say a little bit more what I want on that site, but specifically because I think people will be asking me directly. But again, for those people that might have taken my passion or felt like my passion was more detrimental, condescending, any of those things, I'm really sorry. It wasn't what I meant to do. I feel badly that it was taken that way or that I came across that way. Definitely not your fault, and definitely appreciative of the feedback, and I'm definitely going to work on that. Definitely get them. Uterine fibroid ablation. Oh, okay. So uterine fibroid embolization. Every doctor has their opinions on all these different procedures, Essure included. I'm not a huge fan of UFE simply because what happens, it's very selective in what